Welcome to my presentation where I'll be talking about instructing physical activity. The components of fitness. The components of fitness are strength, aerobic endurance, muscular endurance, flexibility and body composition. Strength is the ability to carry out work against resistance. Strength is the maximal force you can apply against a load. Training to improve muscle strength includes weightlifting, The components of fitness. The components of fitness are strength, aerobic endurance, muscular endurance, flexibility, and body composition. Strength is the ability to carry out work against a resistance. Strength is the maximal force you can apply against a load. Aerobic endurance, or cardiovascular endurance, aerobic fitness, or stamina, is the ability to exercise continuously for extended periods without tiring. Muscular endurance is the ability of a muscle group of muscles to sustain repeated contractions against a resistance for an extended period of time. Flexibility is the capacity of a joint or muscle to move through its full range of motion. Body composition is used to describe the percentages of fat, bone, water, and muscle in the human bodies. The physiological changes to the body during exercise. These are hypertrophy, increased muscle tone, decreased resting heart rate, increased stroke volume. I have described these here. The FIT principle. FIT stands for frequency, which is how often you train, intensity, which is how hard you train, type, which is what kind of training you're doing, and time is how long you train for. Participants can use the FIT acronym to help remember key things to consider when tailoring programs for an individual. Sporting goals. Calculating the target zone also helps access how much aerobic or anaerobic training you need to improve fitness. The PAR-Q form is a health screening document designed for individuals about to take part in a physical activity. It stands for Physical Activity Readiness Questionnaire. The PAR-Q form is a quick, effective way of screening clients and customers about to participate in a physical activity of any kind to ensure you are safely able to take part without risks to yourself. Risk assessments. Risk assessments are simply a careful examination of what could cause harm to people. We do them so that you can assess whether you have taken enough precautions or need further precautions to prevent harm from occurring. This is an example of a risk assessment. Minimizing participant injuries. The main purpose of the informed consent process is to protect the patient. A capable adult cannot be forced to have any type of medical treatment. In general, anything other than a life-threatening emergency in which the patient is unconscious or requires consent before treatment. The elements of informed consent document. The informed consent form signed by the subject needs to be tailored to the specific project that it relates to. The document should include the following elements: an explanation of the purposes of the project, a description of the procedures that will involve the subjects, including the time and commitment, identification and description of any risks or discomforts, benefits that can be reasonably foreseen, as well as any arrangements for treatment in the case of injury. Statements regarding confidentiality, anonymity, and privacy. Identification of the appropriate individual whom the subject can approach regarding any questions about the research. A statement that participation is voluntary, that consent has been freely obtained, and that the subject may withdraw at any time. The Fitness Code of Ethics. When practicing as an exercise professional, you must also hold an adequate liability insurance. This code of ethics and conduct defines good practice for you as the professional in the fitness industry by reflecting the core values of rights, relationships, responsibilities, standards, and safety. Contraindication. A contraindication is any factor that will prevent a participant from exercising that would make the exercise unsafe. Common contraindications to the exercise are blood pressure that is higher than 160 or 100, body fat that is higher than 30%, diabetes, resting heart rate higher than 100, lung disorders, blood pressure medication and blood thinners, joint conditions. If they have any one of these contraindications, they are not able to participate in the physical activity, and if you are unsure, you can refer them to a doctor to be looked at. Warm-ups. A warm-up generally consists of a gradual increase in intensity in physical activity, joint mobility exercise, and stretching, followed by the activity. This is to prevent injuries. Cool-downs. Cooling down after your workout allows for a gradual recovery of pre-exercise heart rate and blood pressure. The end. Thank you for watching my presentation.